I would like to add my congratulations to peers to the 13 new fellows, because it requires quite some resilience and persistence just to get to this stage, and you haven't even started. Because to get it to the next stage, you have to redouble your efforts and more, but that's what the NIA team are here for, and our AHSNs are for too. You know, almost everything that's in the long-term plan is already being delivered somewhere in the National Health Service, but it's not just delivered everywhere at the moment. And that, in part, is the job of our academic health science networks and other parts of the system to work together to show how we can join up those areas of excellence so everyone has access to the latest, greatest things. There are some great challenges we've set ourselves in. There are some great advances we want to take forward, whether it's new options to see your GP online or radical reforms. 30 million outpatients, that's a third of them, we want disrupted out of hospitals so they're delivered remotely in some way. That's a big ambition, but even more our ambitions in cancer, which you're going to hear some more about this afternoon. The proportion of people getting an earlier diagnosis, by 10 years' time, we want that to move from half of people with a diagnosis of cancer to 3/4. We've also made commitments in the research and innovation part of the long-term plan that 1 million extra patients within the next 5 years will have been active participants in research. We'll have screened another 500,000 genomes, and we're going to speed up that innovation pipeline. Not easy, and the NIA is one of those fundamental things that are going to help us do that. But the bit of the long-term plan that you will be unsurprised to hear that I am most excited about, we will invest in spreading innovation between organisations. Innovators working in the NHS will continue to be supported through the Clinical Entrepreneur and National Innovation Accelerator programmes. Through a major expansion, these will include those seeking to drive quality improvement through non-commercial models. Wow. The NIA has proven itself. It is in our next 10-year plan, so it is great that those who are on the NIA are here today on it. It is one of the mechanisms where we are going to deliver on the commitments we've made to our citizens of universal healthcare, high-quality, safe, cost-effective healthcare delivered to them. And lastly, of course, all this innovation is great, but we have to sell it to the rest of the world. The UK is just a small part of the global healthcare system, less than just 2% of the global healthcare market. So we're also working in partnership with Healthcare UK to help you export your ideas and take them globally. None of these are easy tasks. None of them can be done on our own, but in partnership together, I think we can really crack them. We need the top-down permission, and that is what NHS England, our academic health science network, and our NIA are giving our innovators on this programme, but also the bottom-up support, because we can't do it all for you. We need you to roll up your sleeves, get out of your seats, whether you're a mentor supporting the NIA, whether you're the NIA fellows or other people within the system, to help us drive that forward. And in this dual approach, I really think we've got a chance of addressing the key challenges and delivering on our promise to our nation of a continued high-quality healthcare system for the next 10 years to come, and many more, hopefully.